Good afternoon, everybody. My name is Scott McGann, doing a weekly COVID-19 update for the town of Falmouth. FalmouthMA.gov, actually I meant to change that, so it's FalmouthMA.gov is the website for the town. Health@FalmouthMA.gov is our email. For COVID non-vaccine related, you always call the health department if you've got a complaint. If you've got a question about contact tracing, things of that nature, you dial 508-495-7485. There's a county health, COVID hotline. You could talk about vaccines. They do get about 2,500 calls per day. It's 774-330-3001. And I'll talk about a little bit the town. We are also setting up one as well. So we got a lot to talk about, and I want to talk about the vaccines first. I think most people want to talk about the vaccines. We'll talk about the cases after I've switched it around. And there's been a ton of confusion, even on our end. With things changing. So how the calls have been going with DPH is focusing in on phase one. You know, we have calls with the state twice a week and working on the more phase one. And then the governor came in on Monday and switched it around and says, yes, we're going to start registering for phase two. The problem with that is there's no vaccine much at all. There's not much of a supply of vaccine. And also, not letting us know that we were thinking, they were being told that it's a mid-February sort of phasing into phase two, that, you know, a lot of us have to, you know, make sure that, you know, we were working on certain things that quite would maybe not have been in place as of yet. But, and there's been confusion also on the registration, which I'll talk about. This is the state's vaccine. You do have to register through the state. It's not like you could call the health department and we put you on a list, and I'll talk about that as well. So, the governor has opened it up to individuals over 75, which for Falmouth is about 4,500 people. And then we go into 65 and older with two comorbidities. Senior housing falls into that category. Then we would go into early education, transit, sanitation, and those groups, and then one comorbidity before we went to phase three. So there's a lot of confusion. Let me just jump slides here for you. Again, vaccines in very short supply, and is going to remain short supply for the next few weeks, from what we've been told. At this point, calling us, the Senior Center of Veterans, isn't going to get you to get it quicker, sorry, and it won't get you on a list. Because it's the state's vaccine, and you have to register through the state online system. Now, not everybody's able to register on an online system, and we're aware of that. So we're working towards having registration help locally. I know the state is setting up a 1-800 number as well. And we're planning on doing that locally as well. Okay, so that's things that we were working on for an anticipated mid-February launch of phase two. Now we got to move it up. Right now you can't call the Barnstable County call center. However, they are overwhelmed. I'm just letting you know. You know, and calling us, you know, I could answer a question, but it does, you know, if I'm getting 50 calls a day, then it does cut into the ability to sort of plan. But we are working on a local number. And so, but what I'm saying from this is you still need to be patient. You know, essentially, you know, the governor, by moving the ball up a couple of weeks, gave everybody hope that they'd be able to get one, and it's going to be really difficult when there's no vaccine in the pipeline. So I'm not really understanding why he did that. Obviously, you know, when we get vaccine, if they gave me vaccine today, we would have something arranged very shortly. So we are working definitely on it. So this is what the website, so I'm going to give everybody a little homework if they haven't had a chance. If you're able to use a computer, you'd go on to this, the mass.gov eligibility groups and phases and scroll around in there and see where you're eligible. And then what you would see, what I want to show you is a map. And these maps indicate clinics, okay? In red, you see at Gillette Stadium and a few more, there's a high throughput run by the state clinics. Okay, there should be, or at least there's supposedly going to be one on the Cape. I don't have the details on it yet. It hasn't been set up yet. Maybe it might be, I don't know exactly where anything's going to be. And that would be a high throughput. I think Gillette could be somewhere up around 5,000 a day. So there'll be some state-run high throughput clinics. All the blue ones are private sector clinics, CVS's, Walmart's, Walgreens, all that, those types of entities. As you can see, there's not a lot of dots near Falmouth. There will be. I think there's going to be many more stars as vaccine availability increases. In green, you'll see regional. Now, you don't see a green dot, and you should see a green dot for the fairgrounds, which we'll talk in a minute, which will be a regional throughput, pretty good throughput drive-through site that I think we're going to do pretty well with. And that's going to be run through the towns, the Upper Cape towns, and the Barnstable County. So the nurses from Barnstable County will order, store, and manage the software, come with the vaccines, and we keep the line moving and making sure the fairgrounds is in good shape. And there's going to be, I believe, 4 other regional mid and lower Cape clinics as well. Okay, so those would be in green, indicated by green. Now, I apologize, I do not know why the green dot's not on there. We've submitted everything. Well, Barnstable County submitted for that clinic. There was 600 doses available on February 3rd. Those have already been spoken for, so some people did figure out there was ways in through here, but without the star, it was kind of not fair, but that's the way the star didn't show up when I was anticipating or hoping the star would show up. But people did find a way to register. There was only 600 doses, and it wasn't necessarily limited. It's not limited at this point to Falmouth-only residents. So, the state's been asking us to look at things that could be open through June and having long-term clinics, and so we've been setting that up. So we'll have that fairgrounds starting next week, and then right now it'll run once or twice a week. It depends on how many vaccines. I don't think we're going to get much more vaccines than the 600 for that clinic. Probably be the same the following week and the same the following week. And eventually, if we're getting a lot, then we can run that clinic 5 days a week, or we can run the clinic 3 days a week. It's all going to depend on how much vaccine we get. And we can bring a lot of people through that particular clinic over there at the fairgrounds, and I'll talk about that in a second. There'll also be Falmouth-focused local clinics as more vaccine becomes available. You're not seeing anything there because how this system works is generally what you would do is you'd click on it and it would give you the available appointments. And if there's 600 doses, there'd be 600 appointments. You would pick the one you want, the appointment, fill out all the information. It is clunky and cumbersome, but it is the state system. It's not the towns, anything, and not necessarily, so it's not the town that sets this up, it's the state. So you would, as clinics come up, as vaccine becomes available, you would have to click on it. So how you have to look at this is, almost like trying to get tickets to Taylor Swift or your favorite band or whatever, and you have to kind of keep going on it to see when new things pop up. So stars will pop up with appointments as vaccine becomes available. So it's not set up, and nor can it be set up where we just put a bunch of appointments on a star at the fairgrounds and you get an appointment for March 14th, because I don't know if I'm getting any vaccine on March 14th or whatever particular day. So when the state commits to saying, okay, we can give you X number of doses, you can set the clinic up and you set it as a user on PrepMod, which is the software program that this is running. That'll show, 400 appointments. If it's 4,000, it can show 4,000 appointments spread out over 2 weeks. So it allows you to sort of tailor how you want to have your throughput, but it doesn't allow you to sort of sign up for an appointment when no vaccine necessarily is available. That'll get much better as time progresses. Again, there's not a lot of vaccine. There's obviously high demand. And without a lot of vaccines, you don't see a lot of stars. You will start seeing many more get imported, and there'll be many more opportunities. And so what I'm saying is you need to have a little bit of patience, especially on. But what you can do for yourself is to learn how to navigate this and check it on a routine basis, daily, twice daily. And as appointments pop up, they'll pop up, okay? So you'll see in yellow, local residents-only clinics, and I plan to run those as vaccine becomes more available. In conjunction with Barnstable County. So they have the nurses, the MRC has the volunteers, the Medical Reserve Corps, and we come down and we get X number of doses, and we can go down to, Lawrence School or the high school, one of the schools, and administer those. And you'd have an appointment that if we only have 200, we would run it at a clinic with 200. If it's 500, we run it with 500. If it's 1,000, we might have to run it on 2 consecutive Saturdays or whatever. And also the state guarantees that second dose would arrive to that particular clinic at which you got it for the first time. And so it's very clunky, and it's not very user-friendly yet. I think they'll make some tweaks and changes to it to make it better. And also, we're also working on setting up vaccinations for the homebound, special populations, senior housing, and so forth. And perhaps that might be through the VNA. That might be the way, or, we could use Barnstable County. So, you need to be able to store, work the PrepMod, set the clinics up, and that's what we're doing by partnering mainly with Barnstable County and also perhaps the VNA. And so that's how the clinics go. So it looks really ugly now because all you see is the Walgreens in Mashpee. You don't see a lot of sites necessarily set up. When you do click on most of the sites, there aren't any available vaccines. I apologize. I do not know why the state has not put the star up. I mean, I know everything's been submitted. But that will show up, and it'll show up as a green star. You'll see occasional yellow stars when we have enough vaccines to run additional clinics. You'll also always have the ability to click on any of the blue ones, and as vaccines go up and there's an availability. So if you're really, you can check the Walgreens site twice a day. You can check Marshall counties. You can click on the Gillette Stadium and say, well, I have a niece that lives up there, and I'm going to go, up that neck of the woods. So you have opportunities. They're just scarce right now. There'll be more as time progresses. Again, this was all originally being told by DPH that this was more of in a mid-February, so that's why you don't see a lot of it. The entire county was allocated 900-something doses for the week, so that's, unfortunate, and I apologize, but nor can we here don't make the vaccine, and we follow the rules in which we're given. So keep checking for appointments, and things will get better over the next few weeks. It might take, I think, a couple of weeks before we start getting a decent amount of vaccines. And also, there'll be more messaging coming out to you about call numbers, being able to register, getting aid in registering. And about that, too, is if you have a family member, if you have a family member living in Idaho, for example, they can get on this website and register you. So if you have family members, even though they may not live near you, they're free to go up on here as well, and they can register and do it for you. So, my mom lives in Florida. If they had the same system, I could be looking to register her. You'll need your insurance card and some of your information, but people could register for you. And if you have no other option, then we're working at a town, and the state's also working as well for you to be able to register. So that is what we call. The other thing I want to mention, too, is when you click on the blue stars, they may have their own. It'll go to a slightly different registration program because Walgreens has their own and CVS has their own, but it doesn't matter. They're all sort of asking for the same information, and you would be booking your appointments that way. Okay, so more to come on that, and so I just wanted to make sure I covered that originally, first off. Fairgrounds, you're going to come in on Courier Road. You see the little arrows down in the lower left. You're going to come through. You're going to be checked in to see you have an appointment. This has to be appointment only. Otherwise, it wouldn't look very good on 151. It'd be by appointment only. If you don't have an appointment, you'd be sent away. You'd go follow the arrows over to the barn. There'll be 9 stations there. And then when you come out of the barn, there'll be a place that we have to hold you. So we do have to hold everybody for at least 15 minutes. If you've had anaphylactic shock before, you'd go for 30. So we would be holding you there to make sure you're okay. And then you would go out of Shumet Road to either towards Mashpee or Falmouth, because, again, this is a regional clinic primarily for the Upper Cape. So that's the way it's working. The drive-through is somewhat unique. Most of them are walk-ins. The ones at the schools will probably be walk-in clinics. It takes a lot of infrastructure and stuff to do a drive-through. Plus, the nurses can't be too cold giving you a shot. I mean, they have to be in a at least covered environment. So that's what we're looking at right now. Okay, so more will show up. Probably by mid-month, you'll start seeing more and more opportunities. It's just going to take a little time because, quite frankly, there isn't any really much vaccine out there at this point. So, next, that's it. What I have for the clinics. So learn again. Just to recap, learn the website, learn how to navigate it, or find somebody who can help you navigate it. If you have neither of those, eventually we'll have something for you shortly. And work your way through it. And when you find appointments that you can make, book it. And so as the more and more pop in, you'll have more of an opportunity. So as far as the cases, we broke 1,000 cases over the weekend. We're at 1,047 cases since March 19th. 143 probables since the first of the year. That's the rapid antigen test. There have been 84 cases during the 7-day period from the 21st to the 28th, which was down from 100 and something cases, 110 cases the week before. About 85 to 90 cases are no longer in isolation. Falmouth is about 12.5% of all cases in the county since the start. 14 would be expected based on our population. Last week we were at 12.7. So we've had a better week than the rest of the county, at least in terms of cases. And of course, the VNA and the CTC and the health department, we still do what we do every day as far as contact tracing. You can see our chart. Chart shows that we've had a decrease from last week. Last week we were right at the 110 mark. The week before we were in the low 90s. We're at 84. Hopefully that trend continues as we just do what we do as far as contact tracing. The cases are still on a high trajectory, and hopefully we can flatten that out. Our color charts, remember yellow and red, we had been in the yellow, and really has to do with we've got way more than the 43 cases, so it's the positivity. If we hit higher than 5%, we'll go red. If we're lower than 5%, we would remain yellow. For the second week, we are red, but a slightly lower, we're about a third of a percentage point lower in positivity, so the trend is lower. We had more tests this week, the same number of positives week to week for the two time frames. And so, we're in the red. We are doing better than Barnstable County in general slightly. Their positivity is above 6. Their incidence rate is slightly higher than ours. The statewide positivity is higher. The percent positivity is about what we were for this particular week. The state is, and I'll show this in a second, the state is sort of flattened out a little bit. I'll get to that in a second. This chart's a little on the older side. This is last week's data. We get this from the county once a week, and we hadn't gotten it in today for me to put it on as a slide. You can see that this basically I want to show you is most towns on the Cape are red and have been for a while. County cases have, once they've sort of gone up, they look like they're sort of flattening out in the county. Statewide, they are 4,200, between 35 and 4,500 cases per day. With 100,000 tests, the positivity rate is a little bit down. The turnaround time for tests is under 2 days. There's about 1,878 patients hospitalized. That number had been consistently over 2,000, with 442 in the ICU and 255 intubated. The positivity rate for the 7-day average was 4.4. We had been high as 7% at some point in the 7s. You can see these trends, the graphs that show you the hospitalizations in orange. You can see it's sort of dipping down as well as the deaths. The positivities dipped, and the confirmed cases had dipped. The governor did extend that, sort of got rid of the 9:30 curfew type set up for a lot of businesses, the restaurants and so forth. And as a result of it sort of flattening. And we may be seeing that as well. I would like to see a few more weeks of numbers going down before I would say that. I don't want to jinx it. But that's where we are. So the state's been it's still high, probably somewhere we were around that Thanksgiving time. And hopefully these trends continue, because it'd be nice to get more vaccines, more people vaccinated. The number keeps trending down, and we're all enjoying our summer. That's all the hope. And so that's where we are with that. So the state's showing some good, showing it in a good direction. We've had 1 week of good direction, still with bated breath, to make sure that it does continue. Falmouth Hospital, Cape Cod Hospital. Falmouth's been consistently around 10 people, and between 3 and 5 in the ICU. And Cape Cod's hospital's been high, right around that 20s, with low teens for ICU. It's been relatively consistent since mid-January. So hopefully we can, keep that number, drive that number down. COVID testing hasn't changed. I'm not going to spend a lot of time with it. You still get COVID testing. The Barnstable County, where you get the testing, is the same place we're doing the vaccinating. We're going to probably move that over. But right now we don't need to, because we don't have enough vaccine. We're only going to do 1 day, 600 doses that were pre-registered so at the fairgrounds. But eventually we can move that to some other site on the fairgrounds. You also still have the opportunity to go to CVS's, walk in. A lot of people go to Convenient MD. You still do have the hospital. So you do have the same COVID testing places that you have always had along. No real change on that. Again, social distancing is still, it's still important to do the social distancing. Just, keep getting us and keep driving down the numbers. Thinking about the things you did in the spring, limiting your activities. Limiting your indoor gatherings, limiting what the things that you do as much as you can, and just keep the diligence. Staying home when ill, especially if you're younger and healthy and you think they're just minor symptoms. It's getting tested. It's not hard to get a test. It may be a little inconvenient, but if you have any symptoms and you get tested, self-isolate until you get your results. We do have cases pop up where people just thought it was a sore throat or a scratchiness, and it ends up being a bigger issue. And so, volunteers. If you still want to volunteer, mainly for, actually both, but you want to volunteer for your medical and non-medical, Diane, we do have a lot of volunteers so far. The MRC director hits her email here. There are a lot of people that have volunteered, And so that's great, because when we run these clinics, it's going to be a combination of paid nurses and volunteer staff that'll be doing it. So the more we have, the merrier. My reason being is we're running the clinics at the fairgrounds, being able to get 5 or 6 more nurses to go over to one of the schools and get another 500 or 1,000 done is the way to go. So to recap, state metrics are high, but flat to slightly down. We've been the highest since about the pandemic. We're in the red for the second week, but we've had slightly better week than last. Definitely think about it as community spread. You definitely can get it. Vaccines are being administered. We got through the first responders and the congregate livings into it. First responders should be pretty close on their second dose. A lot of Cape Cod has already got the second dose. Again, supply will get better. I apologize that the state, I think, moved the needle up a couple of weeks when the vaccine isn't available to do much with it. Again, familiarize yourself with the website. Maybe talk to a son or daughter if you're older to help you, even if they're not around, to get familiar with it so that when they look for appointments, there'll be appointments popping up. There will be more appointments. Again, I apologize why the STAR and the direct sort of access to the regional clinic. State has the information. They have to update the website. And so I apologize for the clunky system that's there, but that's the system. I hope the system gets a little bit smoother. There are some things that make it difficult for our people, but so that's what I have for a weekly update, and I will talk to you next week. Thanks.